Cuban doctors have arrived in the Northern Cape. They'll be utilized as part of the province's fight against COVID-19. So the Northern Cape is not it's not the first time that Cuban doctors have been arriving and are assisting the public healthcare system to alleviate pressure on that system. So they will then be deployed to the various districts in the Northern Cape, 5 districts. But to get finer detail, we've got the MEC for Health in the Northern Cape, Mase Manapule. MEC, tell us the profile of these doctors that arrived today and how are they going to be utilized in the fight against COVID-19?
No, thank you very much, Mr. Hendricks. We have 11 of them. We have a family physician, we have epidemiologist, 1, we have health technologist, 2, we have biostatistician, 1, and then the rest are family physicians. So those are the breakdown that we are having in the cohort of the brigade that was deployed to our province.
So how do you see us utilizing them? The epidemiologists, the family physicians, where are they going? What will they be doing there?
Okay, no, thank you. We are going to basically the epidemiologists and biostatisticians and health technologists will remain in Francis, but particularly aligned with Robert Mangalosi Sobukwe. You know that Robert Mangalosi Sobukwe is the only tertiary hospital which we have in our province, and the tertiary hospital is one of the health service package that they are providing is specialist. So we also, those will be then, others will be deployed, and then we know we have one regional hospital which is in Uppington. We have Dr. Harrisukti in ZFM district. We're also going to deploy others there, and we will also from time to time redeploy the others if there's a need, then they will be in. But all 7 family physicians will be deployed to all the district, but the other specialized, which is epidemiologists and health technologists, will be here. And then from there, when we see there's a need for us to go there and have to assess the ground, which also the data that we'll be analyzing, will be redeployed them from time to time. But this is how we're going to deploy them into different.
The profile of the coronavirus in the Northern Cape is a bit different to other provinces. We've got just over 30 cases currently, less if you subtract the active cases, the closed cases. Tell us about that and your fight, the health department's fight over the last 5 weeks of lockdown, and the next month or so in terms of what we're going to do and what we have done.
We are continuously doing massive screening and testing. We are aware that we are in stage 5 now. Stage 5 speaks more of the identification of the hotspots and surveillance. So this is the work that we are continuously doing. And it helps us. Currently we have 13 active cases. We've managed the positive case, the total. And those who have recovered, we've managed to have 13. You can see most of the time when we notice that our people who are tested positive in the province, most cases are mild, majority of them. So we are continuously, clearly says that we got them and identify them right on time before they become worse when they end up being in moderate or severe cases. So those are the things that we are continuously doing. And what we have been assisted by multidisciplinary approach that as a Northern Cape we are doing under the leadership of the Premier. There are other departments who have to ensure, also helping us to ensure that the regulations are being adhered to. They are assisting us with regards to the Department of Safety and Liaison. They have to ensure that continuously the issue of the social distances in all the areas where the economic activities have resumed. They have to ensure that they deploy their forces there in the areas and continuously do. So those are the things, and also our educational program that we're continuously doing in our community to ensure that they practice social distance, they put mask on, they wash their hands, and if not, they sanitize their hands. So I think our work is in collaboration with what our community also assisting us. Our call from continuous insane to our community, we appeal that you adhere to the regulations of the lockdown. And I'm still continuously making appeal to our younger people who are mostly moving out from home, going to get essential to the shop. Please, when you come back, protect your elderly people, and also to those who have comorbidities. When you come back home, ensure that you wash your hands before you touch any surface, because the likelihood you might come and with the virus and also infect our elderly person, and also those who have comorbidity in our, because those are more vulnerable. When they get this disease, they will be easily go to moderate and severe cases. This is a call that we are continuously making to our people, young people, and those who are working, going out.
The health department is one of the 3 departments that gets the major slice of the budget in any province. What is your budget looking like now these days?
The budget is still the same. We know that the president have announced that there is a package that they have identified, set aside. The national is still allocating it. We have not. Our currently, as we speak, we're still having the budget that was allocated to us from the 1st of April. So what we are doing currently, we have to see where we can reprioritize and see what we can now get funding from, to ensure that our machinery of COVID-19 outbreak is not affected because of the limited budget that is there. So those are the measures that we're ensuring. So we're wishing that the movement that as the national do the reallocation, reprioritizing, Northern Cape should also be able to get more cuts. They should not be able to say that because they have less numbers, we are able to. Those are the things that we are doing currently. We are just working around within our budget that is there. But you can see the work is there, is happening. It's not being affected because we have not received any additional funding from national.
Thank you very much. That's the MEC for Health in the Northern Cape, Marcia Manapule. Of course, talking about the 11 Cuban doctors that have arrived here in the Northern Cape. They'll, of course, be spread out through the rest of the province. Of course, very importantly, to the rural areas in the Northern Cape, where the health department has in the past been struggling to get specialists. So a lot of pressure being relieved by the arrival of the Cuban doctors here in Kimberley and the Northern Cape.